This is the second part in a series all about pelvic floor recovery post-baby. Really easy stuff that you can do home, and each of these sessions is going to take you around 5 minutes to do. So we're going to now move on to core. This is core work to help with pelvic floor. So this is the stuff that surrounds your trunk, your bottom, your back, and again, it's going to help support those pelvic floor structures. Now, the first exercise I'm going to get you to do is seated, and this is a variation of a Pilates roll-up. Now, we are not going to roll all the way down to the floor and all the way back up again, because that's just quite a lot on your tummy to start off with. Bear in mind, those abdominals have been on a little holiday, right, and stretched out. We're going to need a little bit more time to bring them back together. What we are going to do is bring your hands to the backs of your thighs and just allow your pelvis to roll under. Can you see that? So I'm not coming back straight, I'm rounding. So you come from the bony parts of your bottom and just allow that pelvis to roll under. Some people feel this as if they're just bringing their hips in towards them. Sometimes if you look down to your leggings and you can see that you want to lose the creases in the tops of your leggings. And then as you hold this position, we're going to breathe in. And on your out breath, it's like you want to draw your tummy away from the waistband of your leggings towards your back. Now, I'm still holding on to those legs. An option to progress this would be to just let your heel come away just on one side, and again, look down to your leggings, open those hips up, come in, and then on the other side, come on out, let your pelvis roll under, draw your tummy muscles in, come back up and up to seated. Now let's just do that a couple more times. So we're going to lift up at the top, breathe in. On your out breath, roll back. Focus first on just relaxing those shoulders. Allow your tummy to come away from the waistband. Let your heel come out and away. Breathe in. And on your out breath, draw that tummy in. Bring your leg up. And on the other leg now, press your heel out and away. Draw your little finger towards your little toe. Breathe in here. On your out breath, draw your tummy in. Come back up to seated. Just for a little breather, push into your hands, open up through your chest. And then from here, hands to the backs of your thighs again. We're going to gently roll back, open up through your hips. Breathe in here. On your out breath, let your heel come away. Gently draw your tummy in. Bring your leg back up. Other side now, let your leg come out and away. Allow that pelvis to roll under. Breathe in here. And on your out breath, draw that tummy in. So that's our first exercise. The next one, we're going to come down onto the floor. So we're on your mat, head down on the floor. Feel the ribs gently press down and those feet down on the mat. Now this one is quite tricky to do because when that pelvis tilts away from you during pregnancy, it's quite hard to bring it back without these hips really working quite hard. If you find when you start to do this that those hips are kind of hammering at you, pop a little cushion underneath your bottom or just a folded up towel. First thing I want you to do, come into your breath here. Breathe into your ribs, and on your out breath, just feel those ribs press down into the mat. And we're going to breathe in and press down. And a little trick of really feeling those tummy muscles working is if you start with the back, so get the back to take the lead, the spine, the tummy muscles will follow. They just want to follow. They want to do what the back tells it to do. So let the back be bossy. Let the ribs come down. Let the back of your pelvis press into the mat. And you will already feel now those tummy muscles start to respond in front, right? So if you bring your hands onto your tummy, let one knee lift up over your hip and just hold this position. And this is where you might start to notice that hip, by the way. So this is where you might think, oh, actually, I need a cushion under my bottom. And you're going to breathe in, and on your out breath, draw your tummy away from your hands. Let your foot come down. Bring your other knee up. Breathe in here. And on your out breath, draw your tummy away from your hands. And then let your feet come back down towards the floor. So your progression from this is to just let one knee lift. And then let your other knee lift. Now at this point, this is why we've got our hands here. Just feel for any doming through the tummy. If it's doming, just come back to one leg at a time. The other thing you can do here is gently draw your tummy away from your hands. And if you feel that base of support through your pelvic floor, see what difference that makes as well. Really flattens this out. And then from here, just let your feet once again come back down towards the floor. And we're going to do that one more time. So breathe in here, and on your out breath, let one knee lift, let your other knee lift. Gently draw your tummy away from your hands, lift through the pelvic floor. Can you also notice those ribs press down into the mat? And then bring your feet back down to the floor. So we've done the roll back. We've done this little, it's a preparation for 100 really. And then we're going to come into a shoulder bridge. So if you just push through your feet, lift your hips up, bring your hands down by your sides. Now again, because of that little movement through the pelvis that happens during pregnancy, here are a few things just to help with the feeling this in your bottom and your tummy. Mainly bottom and backs of thighs you want to feel this, not in the lower back. So just send your hips up to the wall behind you. Can you feel that? And can you feel the bottom working? Press your hands down by your sides. Gently draw your thighs in towards each other so you feel that work through the insides of your thighs, and hold here. Breathe into your ribs and then start to roll back down in towards the mat. And then we're going to breathe in at the bottom. On your out breath, push through your feet, roll under, find your bridge, gently push through your feet. Make sure you're spreading your toes out on the mat. Let those hips lift, open up and relax your shoulders. Breathe in here, and on your out breath this time, just imagine you've got a little piece of string around your tummy and you're going to pull it tight. Bring your hands down by your sides and roll back down to the floor. So there are your 3 exercises to focus on. You've got the gentle roll back, you've got on the floor that 100 preparation, and your shoulder bridge.